Welcome to Season 2 of Public Health on Call, a podcast from the Johns Hopkins Bloomberg School of Public Health. I'm Joshua Sharfstein, Vice Dean for Public Health Practice and Community Engagement, and a former Secretary of Maryland's Health Department. Our goal is to bring scientific evidence and experience to the public health news of the day through informative interviews with scientists, community leaders, policy experts, public health officials, clinicians, and more. If you have ideas or questions for us to cover, please email us at publichealthquestion@jhu.edu. That's publichealthquestion@jhu.edu for future podcast episodes. Today, Stephanie Desmond talks to Dr. Caleb Alexander, an opioids expert at the Johns Hopkins Bloomberg School of Public Health. They discuss the recent $8.3 billion settlement between the Department of Justice and OxyContin manufacturer Purdue Pharma, as well as the expected fallout. They also talk about facing two public health crises, the pandemic and the opioid epidemic, at the same time. Let's listen.
Caleb Alexander, thanks for joining me.
Thanks for having me.
So today we're going to talk about opioids and a recent settlement announced by the federal government. They announced an $8.3 billion settlement with OxyContin maker Purdue Pharma. So among other things, the company paid doctors to drive up prescriptions and hid the addiction dangers of what they were selling. While the settlement is historic, is it enough to bring the opioid crisis to heel?
Well, I think it is no doubt really big news and has been watched very closely by many, many different parties. It's important to keep in mind, while there has been enormous scrutiny regarding Purdue's actions, Purdue is just one of many manufacturers that are being pursued in litigation. And indeed, other parties, in addition to manufacturers, mainly wholesalers and distributors of prescription opioids, are also defendants to much of this litigation. So Purdue has often been viewed as one of the primary drivers of the opioid epidemic, and their bankruptcy is further along in the process of litigation than many other parties where litigation is ongoing. You know, whether or not $8 billion is the right number or is enough, I think depends upon who you ask. As with many issues in pharmaceutical policy, where you stand depends upon where you sit. There have been many individuals, groups of individuals, especially those that have been directly harmed by the opioid epidemic, as well as some individuals representing states, for example, states attorneys general, that have spoken out with concern about the settlement, namely that either or both that the amount of the settlement is not sufficient and that the way that it's been structured is not ultimately going to generate the resources that are needed in the fairest and most efficient way possible so as to prevent further opioid-related harms.
I guess one question that comes to mind as you're talking is, how big a role do you think manufacturers play in the opioid crisis?
Well, it's a great question, and ultimately it will be up for the courts to decide. And it's important to note that there is litigation that's ongoing in many, many different cities and states, counties, and tribal communities as well. You know, manufacturers, again, represent one of the key groups of defendants, but this is a multifaceted epidemic, and the ultimate way that it's played out is not a function of one single party alone. I think some of the concern and liability in the case of the Purdue bankruptcy has had to do with specific allegations of behavior that have been publicly aired. For example, the payment of providers or incenting of providers to prescribe opioids in settings when it may not have been clinically appropriate. And I think if you talk with individuals about the contours of the epidemic, one point that's often raised is that, well, addiction, if we look at addiction as one of the key ways that individuals have been harmed because of the ways that increasing opioids have contributed to soaring rates of opioid use disorder or addiction. The issue is that addiction is a function not just of access alone, but that access is one important component of addiction. In other words, addiction isn't just driven by one's genetics or one's environment, that it takes access as well. And I think that's where claims have been made that the role of manufacturers has been so important in generating that access. Keep in mind, at the peak of opioid prescribing, say 2011, 2012, enough opioids were dispensed in the United States to provide every adult a 3 or 4 week round-the-clock supply of pills. So we're talking about, in some cities and some counties, millions and millions and millions of pills flooding the market.
Mm-hmm. So as a result of the settlement, Purdue will dissolve and be reformed as a public benefit company under government control and will still manufacture opioids. Some critics, including several state attorneys general, say the government should not be in the business of making and selling addictive substances. What's your view? And given what we've learned about the corporate bad actors, is it safe to have government control here?
Yeah, well, this is one of the sticking points of the bankruptcy, or one of the terms of the bankruptcy that has been particularly controversial. So there's the question of whether the $8 billion number is the right number. There's an issue of whether or not the Sackler family that profited so much from ownership in Purdue is being held appropriately accountable. And then there's the issue of this public benefit trust. And you're right that some individuals have argued that the notion of the government being involved in the manufacturing of opioids is just ludicrous. It's a complicated and controversial matter. And the notion that part of the future payout to abate opioid-related harms will come from future opioid sales may be distasteful to some. And in fact, I believe that the tobacco settlements were not structured completely dissimilarly. Now, I don't believe that there was a public benefit trust that was structured in the same way, but some of the payments as part of the tobacco litigation have arisen from continued tobacco sales. So I think it's an area that I think will continue to be debated, and we'll see. I don't think any final determinations have been made as to whether and how this trust would be structured.
Mm-hmm. My understanding is that some drug treatment or drug abatement programs may be funded through the settlement, and I'm curious which ones you'd like to see funded.
Well, it's an excellent question. There was a remarkable piece in the New York Times probably 18 or 24 months ago that asked 20 or 30 different experts how they would spend, I don't remember if the number was 100 billion or some figure, on abating the opioid epidemic. And it was remarkable to see the differing opinions of a police officer and a paramedic and a public health professor and a judge or somebody like that. I think treatment for opioid addiction is an outstanding place to spend a very, very considerable amount of abatement dollars. What the exact number should be, I think, requires more careful calculations. But when you look over time at what the major legacy of the opioid epidemic will be, it's going to be in the 2 to 5 million Americans, depending upon your definition, that have opioid use disorder. And this is a chronic disease. This is a lifelong disease. Now, it happens to, fortunately, be a disease that's treatable and for which we have FDA-approved therapies. So it's not a disease that one needs suffer from lifelong, but there are many, many hundreds of thousands of individuals that are likely to have active opioid addiction for years and years to come. And so I think that the notion that a considerable fraction of abatement dollars would be spent on treating those with opioid use disorder is quite smart. It is important to keep in mind, though, that there are other ways that these monies can be expended as well. And individual cities and counties and states will be left with having to decide how best to distribute these monies across different evidence-based approaches. And here I'm talking about things ranging from naloxone distribution and training to primary prevention and social marketing campaigns, media campaigns that help reduce and destigmatize, help reduce the overuse of opioids and destigmatize opioid use disorder, treating women who may be pregnant, treating children that may have neonatal abstinence syndrome, and so on and so forth.
So this settlement sort of comes about during a pandemic, obviously, of huge proportions. And reports indicate that at least 40 states have seen a rise in opioid-related deaths since the coronavirus began. So how can governments respond to these two overwhelming public health crises at the same time? Or are people ignoring what's still going on with the opioid crisis?
Well, there was a remarkable body of work done in the 1970s by an economist, and he coined the term the issue attention cycle, which refers to this phenomenon that all too often the public attention and focus on a particular matter, whether seatbelts or drunk driving or obesity or disparities in care, that public attention on these matters waxes and wanes in ways that may have very little to do with the degree to which the underlying problem has resolved. And I think what we've seen with the COVID pandemic is that it sucked all the oxygen out of the room. In other words, it's COVID all the time. Now, there may be good reasons for the extraordinary amount of public health effort that has been focused on the pandemic. But it is the case that no fewer people were dying the day after COVID was discovered or declared than the day before. And the big concern over time is that the pandemic has affected the way that the opioid epidemic has evolved and progressed. And there are several different lines of evidence suggesting such. The pandemic has disrupted local drug markets. It's potentially increased the lethality of illicit opioids by introducing greater unpredictability into those markets. Individuals with opioid use disorder may be at heightened risk of getting COVID. Many are at increased risk of severe COVID or death or other severe outcomes if they do get infected. And then, of course, there are all the ways that the pandemic has affected the treatment infrastructure. There are police departments that at least temporarily stopped administering naloxone due to concern about potential COVID transmission, leaving that task to first responders. There are treatment facilities that decrease their operating function. And fortunately, we've seen at both local and also state and also federal levels many different efforts to try to mitigate or buffer some of these unintended consequences. So increased use and provision of telemedicine to provide treatment addiction, increased ability to share information across providers so that care may be less fragmented in the context of the pandemic. So, I think this is an opportunity for us to, as a community, to really rally around those that have been impacted by the opioid epidemic and to ensure that we are both putting in place and also evaluating the impact of these types of measures to ensure that individuals that have opioid use disorder or who have otherwise been impacted by the opioid epidemic don't incur even greater potential harms because of the COVID-19 pandemic.
Caleb Alexander, thank you so much for joining me.
Thanks for having me and for shining a brighter light on these important matters.
Public Health on Call is produced by Joshua Sharfstein, Lindsay Smith-Rogers, Stephanie Desmond, and Lamari Morales. Audio production by Spencer Greer, Niall Owen McCusker, Cian Oates, and Matthew Martin, with support from Chip Hickey. Distribution by Nick Moran. Thank you for listening.